It's sort of like being in an army profession. It's a lifestyle, it's not a job. There was a guy who was attacked with a samurai. A patient actually had maggots in his wound. Burnout is a big thing in emergency. Then you get a general registration.
Right.
And then that's your gateway to PR and citizenship. Like on a hospital hallway, I would just ask like, hey, by the way, I'm just foreign doctor. This is, and imagine selling yourself
My God.
like that. What would you do if someone is choking? Influenzas are killing people.
I just wanted to quickly touch base on autism.
But like apparently Tamim Iqbal was out for 12 minutes.
That cured his cancer.
Welcome to episode 2 of the Chili Flake Studio. We're starting this episode with our condolences to all the lives who have passed away because of the plane crash at Milestone School and College. Our sympathies, thoughts, and prayers are with the victims. Today, we literally have Amar Bipoder Bondhu, and he is to many people as well who he faces on a day-to-day life. He's a lifesaver for many. But for me, he's a very dear friend. He's been working in New South Wales Health for almost a decade now. Dr. Nahyan, welcome to the show.
Thank you, bro. Thanks for having me. A tough act to follow. After Art Cell, you put me down. But yeah, glad to be here. Thanks for having me.
It's an absolute honor and privilege to have you as any guest who come to our show. We're absolutely privileged and honored to have them.
Yeah, and we're going to keep it fairly casual today, of course. And lifesaver not just for you, if us, for me as well. Raat birate onek phone diye tomake jalai, asking for medical advice. And, the agenda is pretty straightforward. We would just like to know you a little bit better, know the industry or the health sector, in fact, a little bit better. So what is it like being a doctor in Australia? Life in ER, some pro-health tips, awareness tips for our guests, and potential process for migration if someone wants to pursue this career from Bangladesh to Australia or say anywhere in the world. Medical profession actually kiভাবে pursue করা যায় to overseas career. And some unheard stories because, every day we hope is different in ER and challenging. So some exciting stories. And then we will wrap up with a short and snappy rapid fire.
Yeah, absolutely. And I hope everyone's going to love watching this show. Just like all the people who tuned in last time, we got an overwhelmingly good response in our first episode. And thanks for everyone who have watched and who've commented. And please hit that like button and that subscribe button on a YouTube channel. Follow us on Facebook. Or the support means everything to us. Now, obviously, Nahyan, before I guess when we were actually planning this episode, I wanted to actually ask you how a regular shift looks like. But obviously now, because of this tragedy in the Milestone School and College, and it's sort of like in your domain as well, it's an emergency matter. I just really, wanted to touch base on, what a non-medical person can do when such a situation happens and it's a crisis time and an emergency. There are victims, then there are people who were basically burning live on fire and burnt out probably 20-30% of their body. I guess what a non-medical person can do in this scenario apart from the rescue team.
Yeah, look, it's onek challenging, first of all, right? So it's like you're in a place where you've got people that are essentially dying. What do you do? What's your natural instinct? That's what kicks in. I think, again, in Bangladesh, it's going to be different. Lots of people out there, এখানে আবার এটা different because you've got a lot of first responders they know their basic life support. So it's a good thing in the society where a lot of people like your just humble bystanders or I জানবে যে I need to perform CPR or do I give the first aid for burn. So I think again it depends on what is happening, but the first and foremost is you need to be safe. So you need to be in a non-compromising state. And especially এরকম disaster কি হয় যে like electricity, your natural hazards, they're all getting the most out of it. So basically, there's an electric line you don't know. You try to help someone, you get electrocuted. And then that's a different story then. So I think your safety is number one. Get to a good spot and then do what you can to help others. Moving them from the source, calling help early. I think that's any algorithm we do, the first thing is send for help. Put yourself in a good spot, send for help, and then try and do your basic stuff, which is just, if doing CPR is what you know, and if someone's unresponsive, you can do a CPR. If just putting things away, if that's your best thing, do that. I think at the end of the day, it's just try not to be too heroic. Just do what you can.
Yeah, talking about heroes, Riyasad and Nahyan, I think there's a news that came out that there was a teacher who saved 20 lives before she passed away, and there's some horrific stories going around, and I couldn't control my emotions last night. So again, lots of prayers and sympathies and thoughts are with the victims. Obviously, Nahyan, thanks for sharing that. And in an emergency, you got unexpected situations, right? I guess, what's the most craziest case you've ever seen in a shift?
Look, I think definition for crazy for me is a bit different to like most people. I mean, like I have to share this story where I think Ifaz was in the emergency, and you don't want to see like most of the time you want to see your friend at work. You can have a tea with them or a coffee with them, but Amar Kaje, I don't want anyone to be there.
Of course.
Primarily because you're in need of some like health thing, and it's going to be obviously. So Ifazke dekha holo je, so Humaira was pregnant at the time. I think so they both came in, and unfortunately, while they were in the waiting room, there was a guy who was attacked with a samurai sword. Like an actual samurai sword. Right. Yeah. So basically, number one, where do you buy a samurai sword, and where did they find a samurai sword?
Was that like a TikTok trend or something going on at that time or not?
Well, little we know, there's some guy got struck by a samurai sword and he's bleeding out. So I say hi to Ifaz, but at the same time, there's blood coming out. So basically, amra ki korbo? Okay, I have to look after this samurai sword. So we all rushed in, and Ifaz and Humaira just looking at, seeing what's going on. But eventually, so basically, yeah, that would be one of the, like things like these are not as common as you'd think. But I mean, a non-trauma center kaj kori, so it's anything that comes through the door. So a samurai sword would not come again probably for a long time. But yeah, I mean, like that was pretty crazy from memory. Yeah, but there's lots of things happening. I can't just say one.
I'd like to add here, Nahyan, do you remember you showed me an image once where you were grossed out yourself looking at it, the head infection thing.
Oh yeah. Oh yes, you remember.
Yes.
So I forgot. Maybe it's just the TSD or like I'm just getting. So basically, should we talk about this?
Yeah, absolutely.
So basically, a patient actually had maggots in his wound. And so basically, I think we all know that maggots have beneficial properties. So basically, onek jagay maggots, they actually wound their, so anywhere, so if you have maggots in the wound, they're actually cleaning your wound, they're actually eating it as well. It's gross, but at the same time, you don't want maggots on your body. And this guy, unfortunately, didn't know that there was a big hole in his head with maggots. And it literally looked like there are at least 100 maggots just nesting in his head, which was probably was a cancerous lesion. And he was sort of, again, this is terrible. But for some reason, I took a picture. And at the time, I was like, have you had a look? There was no patient details. There was just the maggot crater.
Yeah, no.
And I just showed it. I was like, bro, this is next level. And I think you remember that. So
I do remember that. I still get that icky feeling when I think about it.
Talking about photos and like graphic photos, like I have a friend who works for Bangladesh Medical College in Bangladesh, and he deals with like emergency, just like emergency, and sees all these cases coming up, right?
Yeah.
So whenever I'm in Bangladesh, I try to avoid him. Avoid his phone, but he knows that I'm grossed out. Amake protibar phone kule dekhabe. And the things that you guys see and deal with every day, like hats off, I just don't know. And we have a follow-up question to that as well. Like I just don't know how you tune out. Like
I think
turning on a switch and turning it off when you're off your duty, or how does that work?
I think subconsciously we are exposed to this. When amra kintu medical school theke we've been exposed to this, right? So like amra med school theke amra cadaver, like we look at a cadaver, and then amra like we're looking at blood, we're taking patients in, we're doing all the examinations. Amra shobi dekhতেছি kintu from a very early age. So by the time amra kaje already kintu amra একটা resistance হয়ে গেছে, and you sort of unknowingly switch off. It's not something that I'm doing like, okay, I need to switch off now because it sort of just happens. And then I've been in this job for almost 10 years now. So I think in that sense, like, it's sort of just like,
You've seen it all sort of at the situation.
Yeah, so it's sort of like, okay, fine. I mean, again, that's the beauty of emergency medicine is you never see it all. Even people who are a veteran, like they've been there for 30 years, will still say, that maggot was probably something they'd never seen. Yeah.
Absolutely.
That's insane. But again, there's all sorts of weird stuff. But, if I start, this will not end. The cameras will run out. Yeah.
No, I guess, we always wanted to sort of ask you that on your worst days, what keeps you ticking? I guess what's your boost is the secret of my energy moment.
Well, we joke about this. There is a coffee that healthcare workers here drink, and it's a free coffee. It's called the International Roast. It's good. It's better than all the Maconas and Nescafe here. Nice. Unfortunately, they're switching the coffee now, but that would be the secret of our energy. It's like that free coffee does get us through long night shifts. Look, I think, it's hard. Some days we're just like every other job. It's still a job. Yes, you have to look after people. You still have to cater for their needs. There's going to be days when you don't feel like doing as much. But eventually, আমার switch off করতেই হবে. Sometimes I'm just there. Autopilot mode. মানে মনে করো যে তুমি যেভাবে কম্পিউটারে লিখতেছো, যে আর ভালো লাগতেছে না, আমারও এরকমই সেম লাগে, একদম সেম. I still have days where I just don't want to go to work.
Absolutely.
But যেতে হয় because কতই আর sick call করবো.
And how long is a typical shift?
So look, we are very fortunate in New South Wales. Like emergency doctors কিন্তু 10 hours মানে আমরা 10 hours এর মতনই থাকি. মানে এর থেকে বেশি না. একটা typical shift lasts for 10 hours.
Okay.
Unfortunately, মানে this has been a big issue with the class action lawsuit in New South Wales about junior doctors staying longer than they should without getting paid. And this culture is slowly shifting. But emergency, because I'm a shift worker, আমাদের shift কে replace করার জন্য আরেকজন on time চলে আসে. So basically 10 hours is what we do.
And I think it's not only about the payment thing, it's also about, again, burnout, right? The 10-hour shift পরে তোমার যদি আরো extra 2, 3, 4 hours করতে হয়, the things that you're dealing with, you have to be 100% every single day, every single moment. So there's a question of being switched on all the time, but you're a human, and then you're treating humans.
I mean, look, burnout is a big thing in emergency medicine. I think any acute care medicine, burnout is something that you have to learn to deal with. And the biggest thing about burnout is you don't know you're burned out, and you feel it for like a month or so, and then you realize you're burnt out.
Right.
And that's a problem. And that is a big thing. Like, it's happened to me multiple times where like, why do I feel like this? আমি কেন এরকম হয়ে আসছি? মানে একটা থাকে না যে একটু কেমন why am I doing this? But then you realize that that's burnout. And the first time this happened probably many years ago, and I'm sort of like, oh, so this is burnout. So I'm not burnt out.
Yeah. Right. So you actually understand the true meaning of burning out.
Right? So it's sort of like, I think we all face burnout. আমরা Western society we've got less family here.
Of course.
আমরা সবাই কিন্তু not just work এ burnout. মানে life নিয়ে মানুষ burnout হচ্ছে, you need to stop. We need to regroup, rethink, and then come back to society again, right? After holiday লাগে সব সময়. So so you never know when you're burnt out, like initially. পরের দিকে you'd learn to deal with that. I think you to plan holidays around it.
Like the importance of mental health and sort of stopping and then starting all over again, which we all face day in, day out.
আমি সবসময় বলি যে it's a noble profession. মানে you're making a difference.
Of course.
Like there are only very few professions in the world, and one of them is obviously medical profession.
It has its pros and cons. Look, I mean, if you've known me for what now, like almost over 5 years. Like I've been times where I've always said, look, it's something that I never want my kid to do. But then if my son shows that level of enthusiasm and if he really wants to do it, I won't be against it per se. Like, hey, আমি পুরা পিকচারটা ওকে পেইন্ট করবো, but if he's that passionate about it, I think it's a very good profession. I think there's a lot of rewards to it, but there's a lot of burden from society as well. So basically, it's a lifestyle. It's not a job.
Right.
Is what I
Actually, বাংলাদেশে তো বাবা মার স্বপ্ন থাকে যে ছেলে বড় হয়ে
ডাক্তার
ডাক্তার হবে, ইঞ্জিনিয়ার হবে।
Engineer.
ইঞ্জিনিয়ারটা কেন বলতো আমি জানি, কিন্তু ইঞ্জিনিয়ারে কিন্তু আসলে আমি মানে লয়ার বুঝি, লয়ার বুঝি, বাট ডাক্তার একটা সবসময় একটা স্বপ্ন থাকে। ইনফ্যাক্ট মাই ড্যাড হ্যাড দিস, এবং আমাকে সবসময় বলতো যে যেদিন আমি ডক্টর হব গ্রামের বাড়িতে গরু জবাই দিয়ে সবাইকে খাওয়াবে, বিশাল বড় পার্টি করবে। But obviously, I mean,
I can confidently tell you, Jay, my dad's first choice was not me becoming an accountant for sure.
of course,
He wanted me to take physics. He wanted me to take chemistry.
science পড়তে হবে,
মানে আতেল হইতে হবে।
exactly, science পড়তে হবে। What is
I
market?
thought uncle would be more into cricket. মানে cricket নিয়ে
Nah, like, so sports always একটা priority আমাদের বাসায়. Like sports takes precedence over anything. Like. And that's I love that, right? I want to do that with my kids as well. And sports are priority score, and I think you can add in a little bit here as well, because I think kids stay occupied with the good things if they're involved in sports or any group activities, be it a dance class, be it musical instrument and whatnot. So আমাদের ওই দিক থেকে অনেক encouragement ছিল. The only thing my dad discouraged was getting into the army, him being an army officer himself.
Yeah,
very similar to what yours.
Look, it's sort of like that. I actually use that analogy. I mean, এটা use করি যে it's sort of like being in an army profession, but it's a bit different in one way. Like we don't have to go away for months, and the training is obviously intense training, whereas আমাদের training there's like more of a mind training and strengthening your mind, I guess, if you want to say it. Obviously eto na, but it's very like you need to be disciplined to be involved in this year. So any form of discipline, let it be mental, physical. A lot of physical stress amader hoy, but there is a level of discipline in the job. Yeah, so it's
and like Nahyan, and good point you raised there, because I guess this is more for the people who's wanting to migrate to Australia. And how was your journey to Australia as a doctor? Because if I'm not wrong, BMC তে
so আমার বাংলাদেশ মেডিকেল, আমি ওখান থেকে মেডিকেল স্কুল করলাম.
So just walk us
so
through.
that was an MBBS, right?
MBBS.
Okay.
Walk us through the different stages, I guess, from starting your career, like I guess studies in Bangladesh, your career or whatever, and then moving to Australia and then setting things up here. The whole process, so that it's actually good for the doctors who wants to pursue maybe migrating.
Look, I think আমার জন্য a massive thing was the fact that Abbu is medical. So my dad is a surgeon, so he's a urologist. And Abbur থেকে আমি actually pathway গুলো একটু বুঝতে পারতাম আগে থেকে. So like I knew that I need to do these early. মানে আমার যদি আমি বসে থাকতাম অনেক দিন, তাহলে the more time I waste in Bangladesh, the more time I can't go elsewhere. So I think আমার ওইটা ফার্স্ট ইয়ার ছিল যে আমি কোথায় প্র্যাকটিস করবো, because the thing with medicine is that একটা কান্ট্রি চুজ করতে হবে and you need to stay there. You can't just go like, okay, I'm going to uproot myself, আমি আমেরিকা চলে গেলাম, তাহলে আমাকে আবার একদম গ্রাউন্ড জিরো থেকে I need to start.
Why did you choose Australia?
Well, Australia was a bit of a like right place, right time.
Okay.
I think we both আমার ওয়াইফ এখানে ডিগ্রি মানে she was getting a master's degree here as well.
Right.
So ও এখানে মাস্টার্স করছিল, so I came here, we liked the country. It felt like a beautiful place. You know, eventually we both just stayed here. And the system was easy to get into as well.
Right.
I think initially that's what I felt.
Okay.
That
And I work in higher ed, so we have we get a lot of queries for people who want to come here and be a GP or pursue the medical profession. So এখানে কি পড়তে হয় basically এসে MD or GAMSAT?
Right. এখানে যারা মানে so there's a pathway that international students they can be classified দুই ভাবে. So একটা হচ্ছে যে আমার মতো যারা যে আমরা international students, but আমরা MBBS বাইরে থেকে করলাম, করে we came to Australia. আমরা অস্ট্রেলিয়াতে এসে licensing exam দিতে হয়. So মানে Australian Medical Council through
under AMC,
AMC, right? So you give the AMC and then you find a job and then you transition into their role. এখানে অনেক guidelines, but there's a few things there. I won't get into the details, but essentially you need a degree, MBBS. You need a AMC license to practice in Australia under supervision.
No, feel free to add more, because it's gonna be helpful.
No, I mean, look, at the end of the day, মানে একটা hospital you need to be in a hospital to to have a supervised practice, then you get a general registration.
Right.
And then that's your gateway to PR and citizenship.
Right. আরেকটা জিনিস শুনি নাহিয়ান আমরা যে যারা এখানে এসে এএমসি করে লাইসেন্স পায় তারা নিউ সাউথ ওয়েলস এর বাইরে চলে যায় ফর আ প্লেসমেন্ট এন্ড দেন আবার চান্সেস পাই টু গেট ব্যাক টু সে দ্য মেজর সিটিজ আই উডন্ট সে সিডনি বাট সিডনি মেলবোর্ন মেজর সিটিজ এইটা কি একটা গভর্নমেন্ট সর্ট অফ পলিসি বাট ট্রেন্ড
the way it is, it's just that so like let's say আমরা ইন্টারন্যাশনাল পাস বললাম যে দুইটা, so like আমার ওয়েতে যেটা আমি একটা ইন্টারন্যাশনাল স্টুডেন্ট হু MBBS আমি বাইরে থেকে মানে বাংলাদেশ থেকে করলাম, করার পরে আমি এখানে এসে AMC দিলাম. So after AMC, the pathway is basically you need to find a job to do a supervised practice for 1 year. Now, whichever hospital will give you this, you go there.
Okay.
এখন এটা metropolitan hospitals generally tend to not give. It's a very difficult, but obviously now the situations, again, it's hard, but there's more avenues, but it wasn't as easy maybe like 10 years ago.
Right.
I mean, they were a bit more enclosed and closed off. And
is it like a staffing issue as well?
It's not a staffing issue. It's like a vicious cycle, I would say. So what will happen is for you to work in Australia, you need Australian experience. And you need a medical certificate, like an AMC certificate. How do you get that? Well, you need to give the exam and get a job. Well, we can't give you the job because you need experience. Well,
just like
give me the job.
Professor. Right?
So give me the job. So then you're at a stalemate. Then you're like, well, what do you want me to do? So then you have to try and get into the system in the right place at the right time. So sometimes there will be places where they really need you. So emergency was one of them. And if you for whatever reason, if you're lucky enough and you're at the right place at the right time and you pursue that, you need to be quite persistent. So আমি অনেক persistent ছিলাম. মানে early on in my career, আমার একটা booklet ছিল যেখানে like I just called up randomly.
Wow.
Cold calls.
And just calls and like I just went to places.
Wow.
And randomly hallway so like hospital hallway I would just ask like, hey, by the way, I'm just foreign doctor, this is, and imagine selling yourself
my god
like that. And it's
and as a doctor, hey,
and as a doctor, it's not
you're not an international student who just walked into Australia and needs a part-time gig, right?
And it's sort of like, well, and it's that like it feels weird, but whatever help someone can give you, it goes a long way. So I remember this renal doctor actually like stopped, had a conversation with me, gave me his number, he called me back.
Wow.
And that was like, the fact that he didn't give me a job, and আমাকে তো আর job দিয়ে বলে নাই যে চলে আসো, but the fact that he said, look, I like your CV, like you were quite enthusiastic, your communication was great, you're pretty forward thinking, why don't you do this and then get back to me. And I did get back to
sometimes it's the guidance, that's all you need.
Look, I have a story behind this, like if you guys have time for this. So like
of course
আমি কিন্তু বাংলাদেশে I think around 1 year, I think I worked in ICU for about 6 months. Emergency তে ওখানেও কাজ করলাম.
কোথায় work করছিল?
So lab ICU তে ছিলাম for about 6.5-7 months. I mean, look, it's intense. Obviously, I was very junior doctor at the time. So just কাজ শেখার জন্য, keep recent your practice, that's another thing. Yeah, you need to have that. So ওখানে there was this elderly man, like what, 85 or 80, like he's dying basically. So he's almost like he's in renal failure, মানে বেশি দিন নাই এরকম কিছু. তো again, like life takes you in so many weird directions. So I was looking out for the guy, মানে ওনার ছেলে was in Australia, so he's a GP Australia. So উনি মানে এখন মারা যাচ্ছেন, ছেলে আসছেন, কথা বলতেছেন. For some reason মানে আমার সাথে তার কথা শুরু হয়ে মানে we actually just got along, and then like he said, হ্যাঁ আমিও ডক্টর ইয়েতে, but he wasn't being obnoxious. Like হ্যাঁ বিদেশি ডক্টর শুনলে কিন্তু আবার একটা আছে যে oh my god, we have to be a bit more guarded about what we say.
Of course, yeah.
But he was very nice, very down to earth, and I still remember like he was just the nicest guy. And then he sort of said, look after my dad, he just said, look, don't let him suffer. Like, and I said, look, we'll do our best what we can. And so he's walking down the steps, and I was like, what's there to life? I'm going to take my chance. I actually went down the stairs and I actually said, look, I'm really keen on going to Australia. Can you help me out? Right. And this is the level of desperation that was in. He actually, believe it or not, took my number, took my email. He reached out to me. And in Sydney, he called me in Sydney saying, hey, look, I knew you were going to come. Tomar ki obostha, tumi ki ye korteso naki. But fortunately, by that time, I had a job.
Okay.
I got a job. So he was মানে over the moon, খুব হ্যাপি ছিল, like genuine happiness, but he doesn't even know me. So এখানে অনেকজন আছে যারা equally help out করতে চায়, মানে they want people to help you.
That's what the community is all about, right? And I think in this profession, and we're going to come to that a little bit later, like there are many who are very successful coming from Bangladesh. They've made it very big here. And then I guess a lot of people would want to walk that those footsteps as well. I guess, like you said, 6 months you worked in an ICU in Bangladesh. The pay scale there compared to Australia, it's obviously very different, I would assume,
It's
right?
different.
And it can go to any level, obviously, specialist and everything.
Look,
but starting ta একটা approximate কিরকম vary করে?
Starting কিরকম, মানে of course আমরা একটা first world countryতে আছি, মানে মনে করো like like I started working in Costco, and our Costco বেতন would be probably better than Bangladeshi বেতন. So it's not like we all did our odd jobs here and there, like we have to make it here. I think এখানে obviously starting salary would be a lot better, মানে ওইভাবে যদি চিন্তা করি যে আমি
No, not converting, but I guess Australian standard starting salary of a doctor, money.
এখানে কিরকম, মানে ডিপেন্ড করে again, like if you're an intern or a resident, so ওইখান থেকে শুরু করে. So around
give the widest range, it's okay.
No, it's I think now, like if I have to put a number on it, like $35 to $40 an hour or something like that, probably. So like whatever that equates to, and then there's obviously going to be overtime. So there's no fixed salary in that sense.
It's not like a package.
It's not a package. Like একটা tier থাকে, but it usually between that $35 an hour. But then again, factor in করতে হবে যে আমি একটা first world countryতে আছি, I'm a tax-paying resident. It doesn't matter which avenue you're going through. You still have to pay your rent, pay
No,
the
of
bills,
course.
pay the everything else.
But I guess ওইভাবে চিন্তা করলেও ধরো বাংলাদেশে একটা ইন্টার্ন ডক্টর হোক অথবা একটু সিনিয়র ডক্টর, একটু না মানে ইন্টার্নের একটু পরে যদি ধরি,
It's a massive
then
difference.
it's a massive difference. মানে বাংলাদেশে তো it's not, life is not easy, and মানে it's still very expensive, of
So
course.
to give you a contrast, Bangladesh medical আমি 6,000 টাকা পেতাম, ঠিক আছে?
There you go. ওটা কি intern
year. So that was, but again, that's into 2012 when I did my intern year. So 6 থেকে 7,000 or something, which is like nothing. So we all had to make money from elsewhere. আমি tuition মানে teach করতাম. So that way you get some money.
It's the same thing that my friend says. Like, I'm pretty sure he's going to watch this podcast as well. His name is Nafis. He says, আমরা শুধু ওকে সবসময় টিজ করি যে তুই তো ডক্টর, আর তুই তো 2 দিন পরে তুই তো আমাদেরকে চিনবি না। বলতো you guys have no idea how much I earn. মানে in Bangladesh, হ্যাঁ, ওর বলতো যে হ্যাঁ we will go there, but by the time we go there, কতটুকু এনার্জি থাকবে to enjoy all that wealth, I don't know.
So এই reasonটা was one of my main reason for coming into like a country like overseas,
right?
Like যে আমি কিন্তু মানে হ্যাঁ বাংলাদেশেও কিন্তু there's a way to go up, but by the time you get there, like to get recognition, to get business and practice, and you need to do it in a way that মানে এটা কিন্তু আমার করতে হবে, একটা হিউম্যানিটি ব্যাপার আছে যে আমি তো যাতাভাবে করতে পারবো না, মানে আমাকে একটা মানুষের রেসপন্সিবিলিটি নিতে হবে, ইউ গট দিস সোসাইটাল বার্ডেন দ্যাট ইউ নিড টু ক্যারি। সো ওইভাবে টাকা বানাতে হলে অনেক মানে 50s, মানে late 40s,
exactly, there you go.
And by that time, like it's not going to be the same.
Worn out already.
And bro, মানে যেটা তুমি বললা যে responsibility, obviously there's only a certain degree you can do when you're a doctor, like, and then obviously you leave it to the Almighty many times, right? Like there are things. So have you ever seen any miracles ever, mane, in your eyes?
Miracles, I think it's a very like I don't know if I've seen anything like Grey's Anatomy, like something's happening, I bounce on the chest and now it's
আমার কিন্তু ER এর কনসেপ্ট ওইটাই,
so
পরে কেউ একটা ঢুকবে
একটা সাদা কোট, আমরা সাদা কোট পরি না,
আচ্ছা সাদা কোট পর
না
কালো
অস্ট্রেলিয়াতে সাদা কোটে কোটই নাই,
স্ক্রাব বলে না,
স্ক্রাব বলে, তো আমাদের স্ক্রাবস আছে, but anyway, so basically you look, I think miracles, the thing is ED is very fast paced, right? So we move on very quickly, we don't really, it's a good and a bad thing, but আমাদের যে patient report যেটা বলে যে like আমি একজনের সাথে মানে the patient gets to know their doctor, the doctor gets to know the patient, it's a very short amount of time, and then we sort of move on to the next one, we move on to the next. ICU, medicine, ward-এর জিনিসগুলোতে হয়তো আর একটু better দেখা যায়, you see the patient for a longer period of time, ওদের মানে basically if anything happen যে brink of death থেকে চলে আসছে, এটা probably they will be able to see more.
Right.
look, there are miracles, right? There are miracles like that, like a 10-month-old kid who's got a bleed in the head. Next minute, you see they're walking. Like there's been stuff like that, but in hindsight, so it's sort of like after a month, I'm a director goes, you remember that kid? Yeah, but now he's fine. Like
right.
And kids are resilient.
They heal faster anyway.
They heal faster. They're just they're just a miracle. Yeah.
মানে আমার take on Emergencies from New Amsterdam.
New Amsterdam.
হ্যাঁ,
Yes.
অনেক দেখি আমি। তো ওখানে দেখি যে সবসময় or in most cases দুইটা consultant there's always a variation in terms of what's going on. এটা কি real life এ হয় যে তুমি একটা assessment করলা and then another person comes in and says যে এটা তো পুরা ভুল।
পুরা ভুল না, মানে medicine is very nuanced, right? So it's eventually when you get into the higher level of medicine, like you learn the basics, but eventually there's a lot of things that you need to do that is your practice. And I think that's where the junior medical and the senior medical like varies. And that's why we give these exams, because they grill you based on, your experiences and what you do in a scenario. These are very sort of, so they test your high level thinking. And in that case, definitely you will. I don't think anyone has that time to battle over a patient. Eta ekta shotti kotha. Ha, hoite pare, but like very rare.
Very rare.
There's a difference in opinion, but it's sort of, okay, fine. Why? What's the reason? You do a conflict resolution. এমন না যে আমি এখন ফাইলটা ছুড়ে দৌড় মারলাম, মানে
আচ্ছা ওরকম
হইতেছে এরকম
ফাইল শুরু নাই তুমি কখনো। আচ্ছা
তো মানে okay, like you agree to disagree,
of course, but you come to a better solution through that discussions.
Yeah, I mean, look, there's going to be difference in opinion in any job, right? Anyone's job whatsoever, and obviously there's a managerial side to anything, and there's a medicine, like for us it's like the work in itself on the field job, and then there's a back sort of managerial aspect. এই দুইটা obviously very separate, very different skill set, so managerial level যারা কাজ করে, like even যারা doctors, they're facing day in day out like conflicts and politics, the same thing. Whereas when you're on the floor, it's more like, well, time koi, to ar time nai ye kora,
just move on, basically.
Just move on, or like, okay, fine, like whatever, but as long as the patient's safe, patient safety number one. While on shows, I don't know if you've seen the new show, which I've now momentarily lost the thing. It's anyway, we'll come to it. I think there's a new show on Stan that sort of is the absolute, the closest
reality show,
reality ER show, which now cannot jani matha theke chole gelo, but we'll come if I remember it.
Absolutely.
It's a new show. তুমি যখন নিউ আমস্টারডাম বলা, just মনে হলো যে that is actually the perfect example that I can't remember.
We can put the name of the show in our
we can
ask for some sponsorship as well.
Yeah. I'll just be like, hey,
we promoted yourself.
But if someone can find it, that'd be great. But that's so oita mane that show is actually quite accurate in terms of what's happening and what are the challenges of managing a department, and
just on the topic of talking about Bangladesh or Australia comparison. সো ইফাজার আমি হাসাহাসি করছিলাম আসার সময় গাড়িতে একসাথে এটা নিয়ে, যে বাংলাদেশে যখনই এয়ারে যাই, মামা খালা চাচা কয়েকটা নাম্বার তো সেভ করা থাকে, যে যাওয়ার আগেই ফোন দিয়ে দিব যে আমি কিন্তু আসতেছি, মানে নিচে রেডি সবাই, এরকম
আমি তো তোমার মামা খালা,
একদম ফোন দিই, আমাদের এখানে প্রোটোকল ফলো করতে হবে, বসতে হবে। তো এইখানে কি তুমি হ্যাভ ইউ এভার এক্সপিরিয়েন্স লাইক এন ওভার এন্টাইটলড পেশেন্ট, বা এরকম কি হয় এখানে যে কেউ এসে একটা ধরো পরিচয় দিল অর সামথিং, ওয়ান্টস টু স্কিপ দ্য কিউ বেসিক্যালি?
এখানে look, we're in the Western Sydney, the Wild West.
The Wild West, yeah.
Not happening. Obviously, the northern, eastern suburbs, the northern, ওই সব জায়গায়, because there's going to be high-profile patients and people that have got media attention. এগুলোর জন্য আবার একটা different skill set থাকে. I think we're not exposed to that. আমরা হয়তো অত দেখি না, like certainly আমি দেখি নাই কোনো যে আমার ইমার্জেন্সিতে আসছে। of course there's going to be some level of যে আমি কেন এতক্ষণ বসে আছি, বাট বিকজ দিস ইজ আ পাবলিক ফ্রি সার্ভিস, মানুষও কিন্তু ওই জিনিসটা কাজ করে যে এটা তো ফ্রি, whatever is going to happen, the government's looking after me. If you go to a private hospital, it's more there, because private hospital আমি টাকা দিলাম $400, doesn't matter what insurance you have, the first $400 ফার্স্ট হাসতেছে, because ও মানে 3-4 বার গিয়ে আমি বেড এখনো পাই না কেন ব্রো,
সব ভাঙা দিও।
So that's the problem, right? So মানে যে বেডটা পাওয়া প্রাইভেট হসপিটালও কিন্তু it's still gonna take a bit of time ask.
না, বাট মানে মাঝে মাঝে again, look, Australian healthcare, brilliant in many cases, but very annoying in many cases. মানে আমার সবসময় নায়নের সাথে আমার যখন কথা হয় যে ব্রো এটা হয়েছে, এখন তো ইমার্জেন্সিতে গেলে 8 ঘন্টা বসে থাকতে হবে, মানে
আমি নিজে 6 ঘন্টা বসেছিলাম,
মানে 6 to 8 hours, এটা একটা বেয়ার মিনিমাম। বিকজ ধরো প্রথমে ইনিশিয়াল চেক করবে, তারপরে প্যানাডল দিবে 2টা, দেওয়ার পরে তুমি তো মরে যাচ্ছ না, তুমি বসে থাকবে,
ওয়েটিং রুমে পাঠিয়ে দিবে,
ওয়েটিং রুমে পাঠিয়ে দিবে। এখন নাইহান থাকলে হয়তো ওর যদি ক্যাপাসিটিতে থাকে, ও হয়তো তোকে একটা রুম ম্যানেজ করে দেওয়ার চেষ্টা করতে পারে, ওর যদি ক্যাপাসিটিতে থাকে। বাট এগেন, ইটস আ ফ্রি সার্ভিস এন্ড অফ দ্য ডে। দ্যাটস ওয়াই প্রাইভেট হসপিটালে যখন আমি যাই, তখন আমার মেজাজটা টং থাকে,
তখন তুই বাংলাদেশের মুড,
হ্যাঁ তখন আমি বাংলাদেশের মুডে যাই, আমার সাথে এইভাবে কথা বলতেছিস মানে আমি এত টাকা দিই and what not. But yeah, look, I think and this brings me to the topic, the criticality of some of the situations. Like Nahyan, I don't know if you remember, like আমি একবার রাত 10টা-11টার সময় নাহিয়ানকে ফোন দিয়েছি, বলছি নাহিয়ান আমার না বুকে ব্যথা করতেছে, what should I do? নাহিয়ান বলছে যে look, it's probably nothing, but I cannot tell you not to go.
So
the doctor that he is,
the doctor that he is he's very professional about everything.
No, but chest pain in a like, especially আমাদের background, and we've seen, আমরা অনেক দেখি যে আমাদের মতো like we're in our like mid to late 30s, এটা হবেই,
and মানে ওইটাই ব্রো, মানে তুমি if I were to categorize some of the life threatening issues, that ধরো chest pain, choking, তারপরে ধরো ব্রেইন স্ট্রোক, you talked about this emergency response tragedy, we're not going to get to that, but ধরো some of the day to day risks, এগুলাই ধরো যে আমি টপ 3 ধরি, এটার জন্য একটা মানুষের ইমিডিয়েট রেসপন্স কি হওয়া উচিত?
But how do we understand যে এখন আমরা যাব, মানে এটার জন্য কি যাব,
মানে আমার অ্যাকচুয়ালি হার্ট অ্যাটাক হচ্ছে নাকি?
It's very difficult, first of all, a very difficult question. I think there is no clear answer again. It'd be like, okay, look, there's cases where je kichui hoy nai, but then massive jinish hoye geche, and then there's cases where like, you know, je মানে বিশাল একটা জিনিস, but then it's a small solution, is all done. মানে এটা খুব একটা generic answer দিলাম। হ্যাঁ, আমি মানে আসলে chest pain, so I would not ignore a chest pain. যেরকম কয়দিন আগে, like, so when you called me, আমার first instinct ছিল যে chest pain, you know, we're from Bangladesh, আমাদের কিন্তু মানে হাই রিস্ক এমনিতে, আমাদের ডায়েট, you know, মানে ভাত তো খাইতেই হবে, তাহলে তো কোনো ভাই স্টেক, হ্যাঁ যেভাবে স্টেক হচ্ছে, so like, you know, and on top of that, মানে the whole, এখানে কিন্তু সবকিছু বেশি খাঁটি, মানে I think that's the main thing, everything is like proper, too pure, so pure মানে কোলেস্টেরলটাও pure, মানে মিল্কটাও pure, no melamine in your milk, right? So all that thing together, it adds up, you know, it'll like, if we're not, and আমরা খুব sedentary life lead করি, right? Like হ্যাঁ হয়তো অফিস থেকে বাসায় থেকে শুধু
always stressed up,
runs a lot, I know you do, but like
he's always running,
আমি বাসার বাইরে দেখি,
and he puts us into trouble as well. আমার বাবার সাথে দেখা হচ্ছে, বাবা বলে তুমি দৌড়ো না কেন,
হ্যাঁ তুমি কেন দৌড়াচ্ছ না, হ্যাঁ আমি কিন্তু, এবং this is by the way just like a segue, like I have seen Ifaz every time Desh with Ifaz dৌড়াচ্ছে, and I've already seen him always run, so very good, man, this is what
very good,
so
very good, but avoid our family when you run,
মানে বাসার পাশ দিয়ে যাস না, no, but having said that, I think that's a lifestyle that you need to have here, and as a guy in your 30s, definitely like cardiovascular health through running, exercising, you know, 30 minutes a day, like, you know, nothing, but even that is quite, like, you know, it's very difficult to manage.
I think it's about putting importance to it, like self-care is very important.
Self-care is 100%,
so you know, you need to realize that, which you clearly do, but we need to jump on the same wheel, we need to follow him, and
I swear to God, I don't do that, like, you know, মানে honestly speaking, হ্যাঁ আমার কাজে অনেক হাঁটা হয়, so in that way আমার একটু হাঁটা মানে my steps are up, the counter says 7,000 steps, I think I didn't do anything, but having said that, look, chest pain, I wouldn't ignore chest pain. আমার মনে হয় chest painটা especially আমাদের age is a massive thing, a lot of অনেক হয়েছে এরকম, and then like, you know, anything that's going on for a while, like fever for, আমরা বলি fever for 5 days, fever for 5 days মানে এটা একটু
ইনফেকশন কোনো কিছু
হচ্ছে নাকি, মানে you need a look, হ্যাঁ আমি বাচ্চাকে দেখতেছি যে বাচ্চা পড়ে আসছে, not moving, not drinking, হ্যাঁ মানে that's bad, so এরকম ছোট ছোট subtle signs থাকে, but the obvious ones are like, আমার especially for kids, because we all have young kids, right? I think the main thing to look out for is like, is your child acting normally to you? I don't know your child. And this is one thing that it's a textbook thing. It's a criteria in many decision rules. Like, what does the parent think about the kid? Are they acting normally, or there's something a bit different? If there's something a bit different and your gut feeling or your wife's gut feeling, I'm sure like, your wife would say like, hey, okay, amar thik lagteche. That is a red flag. So I would say that, like obviously, if it's like a limb take a blood porteche, I'm not going to say anything. But what are the subtle signs you should look for? I think that's one of them, that he doesn't look right. Many times, like Rupai told me, like my wife, barbar bole je, he does not look right. Literally that
night আমার কাছে always
have nothing to
আমি এটা বলতাম যে gut feeling always comes from the mother, and it's right. Like I appreciate that Jerry sixth sense টা is always switched on. If us Hashim
it can come from the dad too.
I was trying to be gender neutral in this society.
It can come from the dad too, and I think these days especially, and look, all of us are dads here, we put in our extra efforts here and there. I think
definitely.
I think Bangladesh তুলনা করলে Australian dads are supermen.
এটার জন্য আমাদের 2 দিনের একটা পডকাস্ট লাগবে। 2 দিনের একটা পডকাস্ট লাগবে। হ্যাঁ, of course. যে আমি যদি compare করি।
But I think look, it's interesting point.
For me, like I think there's been many times when I was like being so where do I switch off? I think when I'm at home,
you have to switch.
I'm like, Panadol, did I ask my wife, like, do I want to give Panadol? And then she's like, aren't you a doctor? And I'm like, yeah, I know. But like, when it comes to my kid, like, so I use that in my day-to-day life. Like that, okay, what do you think? What's your gut feeling? Like, because I think there's the whole placenta with the bond with your mom, this is like far. I think there's some divine, some divine intervention or something there that's not in our sort of hand. Yes, we are a big part of the family. I'm not gonna disregard you first, but then I think at the end of the day, so if your child doesn't look right, I think that's one thing. If they're not drinking, if they're not eating, if they're just lethargic, just pore ase,
of
don't
course,
ignore. Even if that's the second day of fever and they're just not moving and eating and drinking, you're like, wait, that's not nice.
That's not,
you're gonna go. And I think everyone should do a basic life support course. It doesn't take a long time.
I was about to bring that up, like CPR and basic things that I think everyone should learn.
Correct. Yeah, I think it's a very basic skill. There's a few things that you need to do for kids versus an adult that they will teach you or tell you, or the fact that giving CPR, the whole idea is if you chest compressions is the main thing, and if you're doing it correctly and you're doing it in the right rate and rhythm, that's not the right way. There's been videos online you see trained professionals are doing that because of lack of knowledge. CPR dite jani na. That is the basic life support. You need to know how to give CPR.
I think this is a very good point, and I'm guilty of not knowing it entirely.
Same here. It's CPR and then choking এর জন্য যেটাকে বলে
so the basic life support এর মধ্যে হয়তো choking টা probably পড়বে, but like think like even what would you do if someone is choking and all you know is CPR, you start CPR, right? Because eventually what are you trying to do? Dislodge the thing. You start chest compression, এটা তো either উপরে যাবে or নিচে যাবে, but তোমার তো main যে trachea যেটা your windpipe, you're relieving that obstruction to get some air into your lungs. So eventually কিন্তু choking এও lasting in the CPR there if your child is unresponsive or something. So it's sort of, so if you don't know how to give a CPR, that means your heart is not pumping blood. That means everything is down. So your brain's down, so your heart, everything's down.
Interesting.
So if the pumps,
oxygen যখন না যায়,
so like if your heart's not pumping, basically everything's done.
Man, এইটাই
that's the main thing.
তামিম ইকবালের যে হার্ট অ্যাটাক হলো, আমি শুনছিলাম some ridiculous amount of time, like apparently 6 minutes যদি হার্ট ব্রেইনে অক্সিজেন না যায়. Is that the right way of saying it?
2 minutes bola jay
brain dead hoye jabe.
You start giving like, so if you're dead and if doesn't have, and within 2 minutes you're pretty much down the ditch.
তো যে চিন্তা কর,
so time is brain.
I don't know, look, these are from media reports, so don't quote me on this, but like apparently Tamim Iqbal was out for 12 minutes,
right,
and then now mashallah, like he's up and he's apparently looking forward to get back into professional sport.
Yeah.
Media can be, media can be.
There's a bit of spice added everywhere.
Media can be Grey's Anatomy. Media can be. So it's, I think, the actual reality, like what exactly he might have been unconscious. He might have his heart might have been beating. But if তোমার যদি heart বন্ধ হয়ে যায়, there's no way তোমার deficit থাকবে না মানে. As in, like you might have a bit of brain damage, which is like the সবচেয়ে late term বলাটা যে like হ্যাঁ আমার heart বন্ধ হয়ে গেল, after 2 minutes definitely there's going to be some
vegetable হয়ে যাওয়ার কথা.
Something will happen. But এখন again, that's when the miracle comes in. That's like when you talk about divine philosophy, what's happening out there, what's going on. You never know, So
এখানে ব্রো আমার একটা কোয়েশ্চেন ছিল যেমন and you can choose not to dive deep into this as well.
Sure.
আমি বিফাজের সাথে শেয়ার করছিলাম রিসেন্টলি আমি যেই মেডিকেল সেন্টারে যাই I was talking to the nurse and I was asking her about COVID jabs, right? সেকেন্ড কোভিড জ্যাব দেওয়ার পর আমি আর দিই নাই কোভিড জ্যাব, এখনো তো শুনি যে নতুন নতুন জ্যাব আসে। সো নার্স আমাকে বলতেছিল যে রিসেন্ট যে জ্যাবটা আসছে কোনো ইনগ্রিডিয়েন্টস লেখা নেই ওখানে, অ্যান্ড শি ইজ অলসো ভেরি রিলাক্টেন্ট টু পুশ দ্যাট বিকজ শি ডাজন্ট নো, অ্যান্ড দ্য মেডিকেল সেন্টার is also they're not commenting on that. Again, like not naming names at all, but তুমি যেটা বললা 40-30 onwards we should be careful with heart disease and things like that. We lost a couple of one very close friend recently, cardiac arrest, mid-30s. And এরকম কিন্তু শোনাই যায় যে হঠাৎ করে, but unless you really know someone closely who has passed away, you don't really feel যেটা আসলে কত শুনি যে চলে গেছে বা গেল।
There are some conspiracy theories.
হ্যাঁ, সো এই কোভিডের সাথে এই জ্যাবগুলোর সাথে কি ওভারঅল হেলথ ডিটেরিওরেশন এরকম কি কোনো কিছু বা I don't know, man. It is something. Jab niyo to again. It is something we can talk for 2 days. Koto rokom conspiracy theories, right?
Conspiracy theories are out there. Look, there's all that. I think initially when COVID shuru holo, jekhane we give the jab, it's magnetized, right? And that was like
some chip goes into you or something.
They're tracking you, keeping an eye on you,
and then basically this was a big way to track everyone. And then this koto kichu. So look, I think initially, initial phase এ বলবো যে COVID jabs worked because I think that's how we achieved herd immunity. So herd immunity হচ্ছে যে like আমি কয়েকজনকে immunize করলাম and eventually they will spread that immunity into the whole population. হ্যাঁ, so আমি যদি majority কে immunize করতে পারি তাহলে আমার majority of that immunity will guard my whole population basically. That's the whole idea যে আমি এটা করতে যাচ্ছি. So that's what they want to achieve with immunization, basically. So you reduce the number of cases by vaccinating majority.
Okay.
So I mean, in essence, that's what it.
That's the concept.
That's the concept. So again, now during COVID times, it was basically it was panic, right? It was that we need a solution.
Utter chaos.
Toilet paper. 4-5 বস্তা রাইস নিয়ে দৌড় দিতেছিল।
আর অস্ট্রেলিয়া নিউজিল্যান্ড তো
টয়লেট পেপারটা বুঝতাম না মানে why.
No bidet spray, bro.
No bidet. That's it.
Again, a bidet could have been the sponsor of today's
bidets. Although apparently there's a tough regulation on bidets in houses, right?
Yeah, they're
terrible. Anyways, on a different note, COVID so basically we've seen firsthand that COVID vaccinations did impact a lot. I was a first line sort of worker, right? So
so you guys got priority.
We got priority. So we were the first, in some way we're like, are we guinea pigs? But again, this wasn't just the first, like Australia rolls out things obviously after heavy testing and things. And I think আমরা world pore COVID
compliance is really strict.
Compliance is strict and there's a lot of quality control involved. In any way, I mean, given first line healthcare workers, amra kintu like we're the frontliners, right? So we were glad we received it. And I think it reduced severity massively. I think onek joner life save hoise. I would say that. I don't know now, do you need COVID vaccines or not? Look, it's up to your GP. I think GP সাথে কথা বলে a lot of the time they say যে হ্যাঁ the older you are the more immunocompromised, মানে আমি যদি অনেক young অনেক old তাহলে ভ্যাকসিনেশনটা আরো better for these flu and COVID. Again, these are things that depends on what your health conditions are. Do you really want to take that or not? It's going to be it's again each patient differs. Now on a general note, I think there are benefits to vaccination. So influenza vaccines are readily available and আমরা সবাই নেই. And people fail to realize that আমি আমার ক্যারিয়ারে মানে হ্যাঁ আমি কোভিড বাজে স্ট্রেনগুলো এখানে পাইনি মানে ফরচুনেটলি অস্ট্রেলিয়া দিন আমাদের we're an island আমরা closed off pretty early on.
Big island.
Big island and it's
closed off for a long time when COVID happened, right?
Yeah, so the whole idea that we closed off and for some reason আমাদের কিন্তু strainটা we got lucky. The rest of the world was suffering, like the second sort of wave in India. I think I remember like Italy.
Crazy chilo.
Crazy, right? So এখানে even during COVID times আমার কিন্তু ইনফ্লুয়েঞ্জাতে পেশেন্ট আমি মরতে দেখছি, ইয়াং পেশেন্ট, ইনফ্লুয়েঞ্জা A, ইনফ্লুয়েঞ্জা B killed, right? এখন even now sickest patients with influenza they're dying. COVID not as much. COVID you die because yes you get really unwell, but then your other body, like তোমার মনে করো যদি diabetes থাকে, hypertension, high blood pressure,
it sort of triggers
everything else triggers and you don't get better from it. যারা অনেক মনে করো the people who have cancer or যাদের they're very old, that's more. Influenza young people, 25, 30-year-olds, they're just
wow.
Yeah. So this is the eye-opening thing, and I always say this in a bit of a cynical way. I would say, like, I'm a bit of a cynic when it comes to COVID. I was like, why are you worried about COVID?
There's so many bigger things.
The influenzas are killing people, right? So that's one thing. So the influenza vaccines are there. I think that's a good one if you want to.
I was listening to this radio show, and apparently some guy claimed to be from the future.
There's always some guy from the future somewhere.
So sounds like our emergency থেকে চলে গেছে.
So, and apparently he's from the future. ধরে নিলাম যে ও সত্যি কথা বলছে. And the radio guys, the hosts were asking him, is there a cure for cancer? I think it was like 50, 60 years from the future.
Fair enough.
And he apparently said, no, there is still no cure for cancer in the next 60 years.
Sure.
Does that amaze you, Nahyan?
Look, I mean, who knows, to be honest. He might be right. He might be from the future and he knows. But I think, look, it does amaze me that we're having such advances in technology. Exponentially rise হচ্ছে. AI is getting massive, traction. Just 60 years from now that we have not a cure for a single cancer. মানে এটা একটু আজব, to be honest. এটা আসলে because medicine sort of like technology. Like আমরা কিন্তু অনেক the information input is massive. What was there like 5 years ago, it's not there now. It's different level. সবকিছুই চেঞ্জ হচ্ছে, সবকিছুই
technology advancement is you can't keep up basically.
You can't keep up. Obviously, putting that into clinical practice, there is where you're dealing with like, okay, আমি একটা human কে এটা করব, what are the quality control that's in place, or এটা কি সাইড এফেক্টস হবে, কোনো ট্রায়াল হয় না, জাস্ট অ্যানিমাল টেস্টিং, এগুলোর জন্য কিন্তু অনেক কিছু রয়ে যায়. বাট like the other day people were talking about methylene blue. So have you heard of methylene?
No.
So methylene blue is it's basically like a blue dye. So it's used for like few things, like if there's some toxicity, local anesthetic toxicity. So there's a lot of things, few things you use it in, but apparently I think I saw this thing on, I don't know if it's true on Instagram. Mel Gibson was saying he was injecting methylene blue to get rid of, so one of his friends injected methylene blue and that cured his cancer.
Wow.
I don't know. So again, these are, things that you hear, but whether it's true or not, or whether that was AI generated content, who knows,
Scary.
Scary. It's definitely like there's things out there. Speaking about COVID, right? Like, how did Bangladesh do in COVID? We have a massive population, right? And people just sold drugs on the street, like drugs meaning like there was a very popular drug at the time called ivermectin, right? People were having that and then COVID cha, like there's like something on the street.
There was a COVID cha.
COVID cha, like our like
অনেক কিছু মিশায় ভাষায়ও করতে কোভিড চা খাও.
But definitely there's something natural in there that they're giving to everyone, and then the pharmacist was selling like COVID packs or something that এই কয়েকটা মেডিসিন খেয়ে ফেলেন আপনি ঠিক হয়ে যাবেন, and then people were getting better. But these were not tested on. There was no New England Journal or whatever big journal. It wasn't a peer reviewed article, so we can't put it in our system. But off level into Bangladesh, a lot of people were doing it.
And not just in Bangladesh, মানে যে কোনো দেশে যেখানে regulation is weak, মানে যে যেভাবে টাকা কামাতে পারে basically.
বাংলাদেশে তো ফার্মাসিস্টরা ডক্টরদের থেকে
না ওরা আরো বড়.
No, but with all due respect to pharmacists, like obviously, like it's gonna be যে বাংলাদেশে রেগুলেশনটা কম। হ্যাঁ, সো আমার কাছে একজন আসলো যে আমি তো ডাক্তার কাছে জানি, আমি কি করবো, আচ্ছা আপনি এই দুটো খেয়ে ফেলেন, ওকে সেটা। সো এইভাবে কিন্তু সোসাইটিকে ওরা they're protecting the society in a very unorthodox way, I think. Yeah? So like so then people didn't die as much, so our ICUs weren't as full as other countries যেখানে মেডিসিন নিতে হলে like you have to spend like do you know like the amount of what's the price of like an inhaler in the States? And I just saw this online the other day. I didn't know as well.
100 something
is $70 for $80 for an inhaler, which is here on the Australia thing, it's like $7, $8.
It's nothing.
Nothing.
এটা কি because it's subsidized এখানে?
Who knows?
নাকি
probably could be, but then like normal medications are like massively expensive.
Right.
Maybe the health insurance covers it. We don't know. But
we're lucky to be in Australia given Medicare and everything else. Like
Medicare is it's quite
well, just on the topic of technology, right? I just wanted to quickly touch base on autism. কারণ যেভাবে করে এখন টেকনোলজি ইভলভ করছে, and we are all dads, we went through those tests when we were expecting, but এরকম কি তুমি রেকমেন্ড করবা কিছু কোনো টেস্ট বা কিছু যেটা everyone should do, which is not part of the usual checklist to, or is there a test that can detect autism when if the baby is in a fetus stage, sort of?
I don't, to my knowledge, there is no test.
Okay.
And then getting back to that point is that what is the parental concern? That is your first test. And that is the only test for early detection, right?
Right, okay.
That is my view on this. Because like bacha bor hocche, so it's not like you're going to notice initially. I think it's in a point where you're noticing things and changes, and you have a feeling that something is not right. And I think, look, I mean, definitely there's criteria on autism, there's levels of autism, there's things that a clinician, like a pediatrician would tell you, or probably a GP who deals with this a lot would tell you. But especially like what doesn't feel right to you. Early escalation, right? So you're seeing that this is the problem, and you're escalating this to a healthcare professional who deals with this on a regular basis. And I think that is your first point of, that is your test. That's first.
Right. Okay.
That's your clinical test, right? There is no like আমি blood test করলাম, আমার এটা positive হলো, so it's autism. Unfortunately, এটা এখনো
the test begins at home, sort of.
And a lot of parents do stay in denial.
Look, it is a very difficult,
of course,
very difficult and very challenging lifestyle. It's going to be. It's like I had a patient yesterday. So it's like the mom came in because the son has autism, level 3 autism, so it's quite high. He fell off a table and he broke his hand, but he tried her level best to protect him, but she's feeling guilty that what else could I do? I'm getting tired. I don't know what to do. And you hear the pain. So these are the true pain that you hear when you're in the hospital. Like, has someone got shot? I don't mean to sound like shot and but shot, you get the bullet out, you stop the bleeding, you'll be fine.
You'll walk.
But someone, the elderly person that's suffering quietly, the mom with an autistic kid who's at their bare ends because they want to give the kid the best that they can, but কি করবে?
পারে না. And like I can't even imagine. And kudos to those parents who,
of course,
who they're real life superheroes, basically, fighting it out there.
And there's so many, parents that are just onto it. Like they know what to do. They know their kids inside and out. And even with high level autism, I've seen personally, like the way they're managing, it's insane. Amazing. And hats off.
Definitely.
We're at the end of the show, almost.
I feel like I've blabbered on.
No.
And I've not let you guys talk.
No.
That was the whole point.
That was the whole point.
That was the whole point.
You have the stage, you speak, people will listen, and very good content, very good insights, Nahyan, for sure. I guess before we go to the last segment, there's one, now that I just think about it, there's just one little question I have.
Yeah.
We were just touching base that there's so many successful doctors in Australia and coming from Bangladesh. Probably the same alma mater of you, like yourself or whatever. But then Australia, you guys are very successful, doing very well, contributing to the healthcare here, which is top notch, as we all kind of agree to a certain degree. But then Bangladesh কেন healthcare নিয়ে এত complain মানুষের?
I think is it a big topic. I think the problem is there's too many medical schools and there's less regulation because at the end of the day, medicine is a very guarded profession, right? So you're the reason for the 99th percentile, like the topmost people going in is because they want people. It's sort of like a filtering system. Do you think that the smartest guy or the smartest medical student is not going to be the best doctor? No. I can tell you that. Yeah, that is not. But it's sort of guarded in a way. It's filtered out in a way in Australia that only a certain amount of people can get into the system. And it's done with intent. That's it. Of course, you want the best minds to deal with human lives. And I think that is one of them. But in Bangladesh, it's not the case, right? So
governance issue.
There's a governance issue. There's a almost like a quality control issue. And there's too many medical schools. So what used to happen? So I'm from a third generation doctor. So both my grandparents were doctors. Wow. My mom and dad were doctors. And then I am the third.
That's why you don't want your kid to be.
I don't look again. I said, thinking back, if he really wants to, I have to give him the whole thing, and then and it's so. What used to happen then was there's only সরকারি medicals. সরকারি medical কি একদম top tier মানুষ একদম পরীক্ষা দিয়ে যেতে হবে, and then they're getting groomed in that way, and then they're becoming. It's a very small amount of population. Hey, মনে করো 1% of the population or 0.5% of বলা যায় না. It's like a very again that number just came out of nowhere, but I would say it's a very tiny amount of population that are exposed to this field because again, it's not just your regular job. There's a massive societal burden.
I think it wasn't privatized back then as well. সব সরকারি medical ছিল.
So এখন যেটা হয়েছে, unfortunately, যে in Bangladesh there's a lot of private institute, like every alleyway probably has some sort of medical school.
Or fake doctor আছে শুনে.
হ্যাঁ, মাঝে তো দেখলাম আমরা টিভিতে fake doctor treating, operating and whatnot.
So it's like if you don't know, like again, I'm not like if you don't know what ICU stands for. Then what are you doing? Wow. So that was a video that blew my mind.
Exactly.
And I'm like, okay, do I know the meaning? I said, and I actually said, yeah, intensive care unit. Okay, fine. I had to check myself, like, how does that work? Okay, like, did I miss something in med school or what's going on? Right? But it's those things, like people, it's not just about, daktari porlam. Anyone can, if you study all my books, you're going to have what I know, right? But it's not just that. It makes you, like তোমার নলেজটা নিতে হবে কিন্তু থ্রু পেশেন্ট, থ্রু এক্সপিরিয়েন্স, দ্য জার্নি, এন্ড এক্সিকিউশনটা ইম্পর্টেন্ট। এবং অনেক কিছু কিন্তু ওই কালচারটা শিখতে হয় থ্রু ইউর ওয়ার্কিং। আমার কিন্তু আগে অনেক ফ্রাস্ট্রেটেড লাগতো যে ঠিক আছে এটা কি পেশেন্ট এত ভালো লাগতো, বাট ইউ লার্ন টু ডিল উইথ দোজ থিংস, এন্ড দ্যাটস আ হিউম্যান সাইড অফ থিংস। আই এম নট জাস্ট সেইং যে আমি ফার্স্ট দিন থেকে যে আই এম ডুইং, উইথ seniority comes a lot of clarity. Right, this is what I have to do. This is my responsibility. I can't just be okay. That guy's this. I'm just gonna let him be. It comes with time.
বাংলাদেশে কিন্তু অনেক অপরচুনিটি আছে in this field. Like নেপাল থেকে কিন্তু অনেকে পড়তে যায়। তো BMC তে there are a lot of students যারা আসে, এবং আমি এক সময় নেপালে যেতাম অফিসের কাজে অনেক, আমি দেখতাম স্টাডি মেডিকেল ইন বাংলাদেশ, ওদের বড় অ্যাডভার্টাইজমেন্ট অন দ্য রোড. So if this could have been like, if there was proper governance around this could have been a big industry for us in terms of earning revenue as well.
Look, I think earning revenue definitely, but then again, because it's going to be, exactly. I think if the private sector, like there's only one from knowledge right now, there's only one private medical school here, which is the Bonds University.
The Bonds.
So again, getting into that, there is a scoring system, there's a massive financial aspect to it as well. So you're if you really want to be a doctor, that's the whole idea. I'm just kortesi because bap ma bolche amake korte hobe. It's a bit of a, then you're like, okay, then where is your value standing? Like you still have to be that person who needs to look after your patients. And then, so that's where the difference, the gray line. I think probably that's where things fall off, because that's what your thing is. Then why are people complaining? Well, then one is that. The other thing is probably the practice here is very evidence based. So you're basically, again, oje COVID cha versus ekhane ami kagoz portechi, and so that's the thing. It's a national protocol that everyone tries to follow. That's the base. So everyone's safe. Whereas okhane there's a bit of a gray zone, I think.
Right. So now it's time to spice things up because it's the chili plates
to rapid fire.
We're gonna put Nahyan in the spot. Yes, you wanna?
I'll load my guns and start.
Yeah.
Okay, so the first three is basically myth or fact.
Sure.
So I'm gonna ask you a question. You're gonna say if it's a myth or a fact. Some patients come in with things stuck in places you wouldn't believe.
Oh, fact. 100% fact.
Emergency rooms in Australia are full of drunk people on weekends.
Full fact? Probably fact. Fact, yeah. I mean, there's a lot of drunk people.
There's a lot of drunk people, especially in the wild, wild west.
Yeah, I mean, you could say that. But not full of drunk, but there is a couple.
Okay. Erectile dysfunction cannot be resolved.
Oh my God. What is this erectile? Okay. Cannot be resolved.
Myth or a fact?
It's like a negative double-ended question. I think it's a myth probably because it can be resolved. I think there are things. Yeah.
There we go.
Yeah. That was a very sidetrack.
That was a googly.
That was a googly. Yeah, okay.
Okay, so ED physician or GP, which one would you pick?
Oh, ED physician.
Fantastic. Yeah. One medical gadget you can't live without.
Well, can't live without medical gadget. Oh man, okay, this has to be the stethoscope because in my profession I need to use it.
Yeah, thought so. Most underrated health tip in one word.
Most
underrated health tip in one word.
Look, hydration. I think
it's a good one. Yeah, it's a very good
hydration.
One. It's the last one, Nahyan. You did pretty well, must say. If you could swap lives with any other profession for one day, what would it be?
That's not a rapid fire question. That's like a deep thought question. Look, man, you caught me there. I don't know. Yeah, I have to think about that one then. Probably a chef.
Okay.
Chef.
Yeah, Nahyan makes superb meals, by the way, and very good-looking meals.
Nice.
Yeah. For some reason, I think I would have like a mid-end chef who's doing a lot of, not like a high-end chef, but for some reason, local. You know what I mean?
Home chef.
But no, restaurant হইতে হবে এরকম যে এত fancy কিছু না,
but খাওয়া থাকবে
homely খাওয়া.
Time out. You need to have time out level of food being delivered to you at a constant rate.
Well, Arik, if you're listening to this or watching this, Nahyan just did an advertisement for your mom's restaurant.
Oh, is it? Big fan. Whoever owns that restaurant, the consistency. I mean, last 3 বছর খাই নাই, so can't say, but yeah, it's probably one of my favorite. বলে না যে death row meal কি হবে, one of those time out for
Bro,
me.
Nice.
Time out brings so many memories.
Oh my God.
আমাদের ফ্রেন্ডদেরকে সবাইকে ফ্রি খাওয়াইতো Arik for years.
That rice with that consistency with your
we're getting sidetracked completely, but I'm loving this.
But what I'm trying to say is that that chicken, that chili chicken, the chicken basil and the beef basil, man.
Classic of the Bangladeshi foods.
And I would say this for the third time: if Time Out is watching, sponsorship.
I think now
Arik will tune off.
That's when it dropped.
That's it.
No, thank you, Nahyan, for being part of our show in the second episode. Thanks all for tuning in. If you've liked what you've seen so far, and obviously we really appreciate all the support you guys have given us on social media. And we also might as well mention the studio we're here, mic'd up podcast studio. Thanks guys for hosting us and making things very easy. Just plug and play here. So fantastic arrangements here. Hit that like button, follow button, subscribe to our subscribe to our YouTube channel. Follow us on our social handles. This is Ifaz and Riyasat signing off.